Good morning. Thank you for inviting me to this meeting, and thanks to my friend Christophe Cognard for his nice lecture. I will show him some of these desserts. These desserts are not so rare as you think. So this is a paper in the European Stroke Journal, the study prepared by European Stroke Organization. And on the map you see how many thrombectomies are performed in European countries. The more blue color, the more thrombectomies are done. But even the most active countries, which are here, France, Germany, Switzerland, Czech Republic, and others, even these countries are not doing sufficient numbers. If we go in details of this survey, there are 44 countries in this survey, and in 20 of them, so in almost half of them, there are no plans for endovascular treatment at all. In many countries, there is limited availability of 24/7 service, and if we calculate the number of ischemic stroke treated, it's less than 2% of ischemic strokes who receive endovascular treatment. And 34 of the 44 countries reported officially in the ESO survey that they have the lack of trained personnel. So no fake news, this is official paper from European Stroke Organization. This is another study published from United Kingdom, which analyzed the situation in United Kingdom, and the conclusion was that approximately 10% of all stroke admissions in the UK are eligible for endovascular thrombectomy. And even if we include advanced imaging for later presenters, it may be up to 16% of cases. So this may be the ultimate goal for our effort in this field. 10 to 16% of ischemic strokes treated by thrombectomy. If we summarize the data from these two papers, from European Stroke Organization survey and from this McMeekin paper, then we end up with this graph showing that we need additional 350,000 endovascular procedures in Europe to cover the needs of European stroke patients. So it means 7 times more than is the current number. This is a graph again analyzing the data from the ESO survey and combining this data with the 16% estimate from McMeekin paper, and you see that even the best countries like Germany and France are still in about 1/3 of the real need. We can discuss what is this. Maybe you are right that it is not lack of centers, maybe it is just lack of referrals, but still we have a lot of work to do. But if you go further in these countries review, I cannot do it in the respect of time, you find very good, very rich countries like UK, like Sweden, like Poland, where they do almost nothing. So we published a couple of provocative statements in Euro-Intervention, and this what Christophe Cognard quoted on the ESC website. It's also our position. What are the obstacles and limitations of acute thrombectomy availability? Of course, it is the nature of acute ischemic stroke, no pain, and patient cannot speak sometimes, and so on. The complexity of multidisciplinary stroke care. For treatment of acute myocardial infarction, we need only one interventional cardiologist, if I a little bit oversimplify. But for treatment of acute ischemic stroke, we need at least 3 specialized experts with different expertise. The lack of trained neurointerventionalists, I mentioned already, it is a reality, it is not a fake news. It is probably not reality in France, it is not reality in Germany, maybe in Switzerland. Maybe also now in Czech Republic we have enough specialists, but in most countries it is a reality. And of course the turf battles which we discussed. It doesn't work. So I skipped the turf battles because we are behind the time. I skipped some of the slides. This was shown, so I've skipped this as well. I'm afraid the battery is weak, so I cannot push the slides. I will probably ask for next slide, the technician, because this remote control doesn't work. There is a paper showing that stop in non-interventional center is related with 95 minutes delay in reperfusion. This is horrible in the setting of acute ischemic stroke. So probably the logistics of acute ischemic stroke treatment for suitable patients for thrombectomy will follow the logistics of acute myocardial infarction. So to send these patients directly to thrombectomy centers. But we don't have enough specialists for 24/7 services. This was discussed, so I tried to skip it. This is just the list of places where it is already done by cardiologists with nice results. So it is not a dream, it is a reality in some places. I skip again. What is the evidence from cardiology places? The first cardiologist who started to do acute stroke thrombectomy was Mark Abelson, who started in South Africa already 10 or 11 years ago. And he published his experience, and he repeatedly speak during our intervention meetings, EuroPCR. We collected our early data after first 3 years of service, together with Mark Abelson from South Africa, and together with again, first 3 years data of Istanbul Center. And this paper was published in Journal of American College of Cardiology. And the results were comparable to the results of major trials done in experienced centers. And these are data of from our center published in Eurointervention. And if we compare the data from our center, and these are, again, I repeat, data from the first 3 or 4 years of our service, if you compare this to data from randomized trials, our results are not different, even if we remove, because in this number, in 43% functional success rate, this includes posterior strokes. So if we remove posterior strokes, which are not included in the other trials, we go even up to 57%. And these are the data from Turkey, from Professor Ömer Göktekin, similar results, 57% functional success rate. The proposal for cardiology training, which was discussed by previous speaker, I will again skip to allow time for discussion. So I agree that we have to work together. I agree that we should keep high professional standards, but probably the way ahead is not to discuss about the time, about months or years, but to discuss just about number of cases and number of procedures. Maybe that's the place where we can meet. And allow me at the end to show a nice case, how working together, radiologists, neurologists, cardiologists, how we can quickly resolve a complicated case. And this was a patient presenting in the middle of the night with acute leg ischemia and was immediately treated by bilateral angioplasty. And he was okay. The next morning he was doing fine. But after 18 hours, he suffered acute ischemic stroke. Because this stroke was, he suffered this stroke in our cardiology department, where we do also thrombectomies. So we treated it immediately with stroke thrombectomy, and he recovered completely. And of course, when this happened within 2 days, we looked for the problem, and we found a patent PFO with bilateral shunt and pulmonary embolism. So at the end, we closed his foramen ovale, and after 1 week, he went with full neurologic recovery. He went home after all these procedures, and we were proud, and we put it in Czech TV as advertisement for stroke treatment.